What patient are we starting with today?
Well, let's see what we got today. All right, so it looks like today we've got 70-year-old man who comes in accompanied by his wife with complaints today from the family of forgetfulness and some mild confusion. You know, this is unfortunately for us something that we see all too often. But so when this guy comes in, what's some of your initial thoughts?
Well, a dementia workup is first and foremost. So if I hear somebody's having a memory lapse, not forgetting somebody's name per se, but say they forgot where they were going driving home from work and got lost driving home from work, something they've done repeatedly.
That's one of the things that would probably scare me the very most in life.
So
I would almost rather have a diagnosis of cancer than memory loss, it seems like, just on a personal level.
I think that's about universal. I do. I feel the same way myself. And high periods of stress, you can get those little memory lapses. And the first thing it does, a little adrenaline jolt.
Yeah.
Okay, I'm good. But sometimes it is pathologic. You start seeing people develop repetitive. They tell you the same thing over and over again. Not 6 months apart, but within the same conversation. Once again, forgetting where they're going. Not just forgetting where they put their keys, but forgetting how they got there or where they were going in the first place. These are the triggers that we look for and say, okay, we may have something pathologic going on, not just stress or age-related lapse in memory.
Because I can't tell you the number of times I forget where I put my keys.
No, yeah.
But you know, it's funny, a lot of times even when I forget where I put my keys, I don't find them in odd places.
No, in the refrigerator or the freezer.
Yep, they're not in the pickle jar, so to speak.
Yeah.
And I know that sounds like a sort of a snide remark, but a lot of times when people are having really bad memory issues or at the beginning of them, they'll begin to find things in places that don't make sense.
Yep. And disorganized behavior, so to speak. They're scattered.
Yep.
Things are going in all different directions in their actions, and it's not following a logical pattern.
Right. And a lot of people, when they come in and they've had any type of memory issue, right, we automatically go to the worst case scenario and we think,
Sure.
I've got Alzheimer's.
Alzheimer's, yeah. And that's the most common, when we look at dementia, that's the most common cause.
But if I look at memory loss as a constellation of things, the first place I go as a clinician is not necessarily to Alzheimer's, even though it's really what we call a diagnosis of exclusion. In other words, we need to rule out other things that could be causing memory loss.
Like a sleep issue.
Yeah, before we arrive at.
Sure.
So sleep issues, medications.
Stress, medications, so that's a big cause. Yeah.
What are some of the medications that you see some of our elderly patients taking that a lot of times end up affecting their
I'd say less so
memory?
now than used to, but there's been a big shift. But benzos were the big thing, benzodiazepines. Anybody who had nerve pills, these were a big cause of problem. But even something, not even a control substance, but benign as antihistamines for allergies. I mean, these things can cause Benadryl, Claritin, Allegra, all these sleep medications. So your Ambiens, your Lunestas, and to dig back into another benzo, but temazepam again. But all these medications have that effect.
I think with the sleeping medicines in particular, any of the hypnotic type sleep agents, and these were really popular in the 80s and 90s and the early 2000s. And so we either used medicines that were over the counter, like any of the medicines that ended in PM, right? Would have some type of sedating medicine or like I said, benzodiazepines being kind of a large group, the alprazolams of the world, the clonazepams of the world that would sort of calm people down and let them go to sleep. Temazepam was a very popular medicine at one point to help people go to sleep. But people forget that when we do a colonoscopy, we use medicines very similar to that.
For amnesia.
Right? And that's constant exposure to these produces some memory loss. And then, so we sort of came out of that with sleeping medicines, and we said, here's this new class of medicines that have come out.
The hypnotics.
And what they'll do is people will sleep better and they're not addicting. Well, what we found out later was they are addicting.
Yes, definitely.
And they also cause memory loss because they're causing amnesia.
Which is one of the first and foremost things. If somebody does have memory loss, even in advanced age, we look at the medications and take those away and see later what kind of improvement are we having.
Yeah, people don't like that though, do they?
No, they do not. They'd almost rather you take their keys.
Yes. And so, certainly medications being one of those things. The other thing that a lot of times I look at is just people's concentration. Because a lot of times I have people who come in and they've got a lot of stress in their life. And their brain is constantly thinking about something else. It could be a sick loved one, it could be a financial situation, it could be, some people are just natural worriers.
And a lot of people have all that going on. And then they have trouble sequestering a word, and next thing you know, it's I need to go get checked out.
Yeah. So how do you help somebody know the difference between frank memory loss and then just when they're having troubles with anxiety? And really it's more of a registration problem. So in other words, like for me, with my keys, if I put my keys down, most times I don't think about where I put my keys down.
Yes. I'm doing doing three other things in my mind. The keys just get put down.
And I'll walk in the door, I'll lay them down, and I'll go on and do my other things, and then I can't remember where I put my keys. And so a lot of times that's more of a registration. If I think about, I'm laying my keys here,
you'll come back and get it.
I could come back later and get them.
Yeah.
But so many times I lose my keys, it's just like, I just don't remember where I did it because I was scattered.
I think you can really help ease somebody's mind at that point, in that it is an isolated incident. It's not happening repeatedly in the same day, and it's not followed by that causing distress to your life. And by that I mean, not finding your keys for a moment may make you late or whatever, but it's not something that is repetitively going on that is causing you trouble with your relationships or trouble to getting to work or any of that, other than just the whole fact that you can't find your keys, but something that's repetitive. I think the repetitive onset, I think that's when you look more into the pathologic. If you're losing your keys now, you come back in the room, you found them, then you've lost them again, and they're in your pocket or whatever. That's when we start talking about there's an issue.